Here is something that surprises almost everyone who takes a blood pressure pill. The most dangerous mistake is not forgetting a dose. It is assuming that because you feel completely fine, the medication is doing its job and you have nothing left to learn. High blood pressure earned its nickname, the silent killer, precisely because it feels like nothing at all, right up until the day it doesn't. And the three pills millions of seniors swallow every morning, Amlodipine, Losartan, and Lisinopril, are quietly powerful in ways most people are never told. I'm Dr. Emily Brooks, and on this channel, I've spent years sitting with people exactly like you, translating confusing medical jargon into plain language you can actually use. If you watched my earlier video, Why You Always Have Mucus in Your Throat, Doctor explains the real cause. You already know I don't do scare tactics. I do facts, gently explained, so you can take charge of your own health. So let's start with a fact that should reassure you. In 2015, the landmark SPRINT trial, published in the New England Journal of Medicine with more than 9,000 adults, found that carefully controlling systolic blood pressure cut the risk of heart attacks, strokes, heart failure, and cardiovascular death by roughly 27%. 27%. That is the power sitting in that little pill bottle on your kitchen counter. The trick is knowing how to use it safely, because the same drugs that protect your heart can trip you up if you don't understand them. Quick question before we go further. How old are you, and which of these three medications are you taking? Type it in the comments right now, Amlodipine, Losartan, or Lisinopril, because I read them, and it tells me how to make these videos more useful for you. Today, I'll walk you through the 9 most important things every senior on these medications needs to know, ranked from foundational to absolutely life-altering. We'll count down from number 9 all the way to number 1, and I'll be honest with you, number 1 is the single habit that determines whether these drugs add years to your life or quietly cause harm, and it's the one almost everyone skips. So don't click away. Let's begin. Let's begin with number 9, the foundation. Everything else is built on knowing what your pill actually does inside your body. Here's the thing most people never realize. Amlodipine, Losartan, and Lisinopril all lower blood pressure, but they do it in 3 completely different ways. Amlodipine is a calcium channel blocker. In plain English, it relaxes the muscle in the walls of your arteries, so the vessels widen and blood flows with less pressure. Lisinopril is an ACE inhibitor. It blocks an enzyme your body uses to make a hormone called angiotensin that squeezes your blood vessels tight. Losartan is an ARB. Instead of blocking the hormone, it blocks the doorway the hormone uses to act. Same goal, 3 different doors. Why does this matter to you? Because the side effects and the warning signs are completely different depending on which door your medicine uses, and you cannot protect yourself from a side effect you don't know to watch for. The benefit, though, is shared. The SPRINT trial in 2015 and a major analysis in The Lancet in 2016 covering more than 600,000 patients. Both confirmed that lowering blood pressure meaningfully reduces stroke and heart attack risk, with The Lancet review showing roughly a 20% drop in major cardiovascular events for every 10-point reduction in systolic pressure. Picture someone like Margaret, 72, who told me she took 2 little white pills for pressure, but had no idea one was Amlodipine and one was Lisinopril, or that they worked differently. When her ankles swelled, she blamed her heart and panicked, when it was simply a known, manageable effect of one specific drug. Knowledge would have saved her a frightening week. Here's your zero-cost step today. Pick up your bottles, read the generic name on each label, and write down both the drug and its class: calcium channel blocker, ACE inhibitor, or ARB. Keep that card in your wallet. This pairs powerfully with number 1, where we'll talk about partnering with your doctor, because walking and knowing your own medications changes the entire conversation. But before that, What happens if you simply stop one of these pills because you feel fine? That mistake is number 8, and it's more dangerous than you think. Number 8, never ever stop these medications on your own and learn the right way to handle a missed dose. Here is the biology in plain English. Your blood pressure isn't cured by these drugs. It is controlled day by day as long as the medicine is in your system. The moment you stop, the pressure climbs back, and with some medications, it can rebound even higher than where you started, putting sudden strain on your heart and brain. The long-term sprint results, published in the New England Journal of Medicine in 2021, make this vivid. When blood pressure was kept under tight control, the primary cardiovascular outcome was about 27% lower and death from any cause about 25% lower than in the standard group. But follow-up studies showed that as soon as that tight control slipped, when pressures drifted back up after the trial, the protective benefit faded. The protection lives in the consistency, not in the prescription sitting unfilled in a drawer. Picture someone like Robert, 68, who felt wonderful after 3 months on Losartan and decided he was cured. He quietly stopped. 11 days later, he landed in the emergency room with a pressure of 190E, not because the drug failed, but because he removed it. His heart never got a warning. So here's exactly what to do at zero cost. Never stop without talking to your doctor first. If you miss a dose and remember within a few hours, take it. If it's nearly time for the next one, skip the missed dose. Never double up to catch up, because that can drop your pressure dangerously low. Set a daily phone alarm or tie your pill to a fixed habit like brushing your teeth. This is especially important after 65, when many seniors juggle several medications and a single missed routine can unravel the whole day. This habit feeds directly into number 2, home monitoring. But consistency creates a new question almost nobody warns you about. What these pills can do the instant you stand up. That's number 7. Number 7 is one I wish every senior heard on day 1. Rise slowly, because these medications can make you dizzy the moment you stand, and a fall can be more devastating than the high blood pressure itself. Here's the mechanism. Normally, when you stand up, your body instantly tightens your blood vessels to keep blood flowing to your brain against gravity. Blood pressure medications blunt that quick squeeze, so for a few seconds after standing, your brain can be a little starved of blood, you feel lightheaded, the room tilts, and you grab for something. This is not a small concern. A major study by Dr. Mary Tanetti and colleagues at Yale, published in JAMA Internal Medicine in 2014, followed nearly 5,000 older adults with an average age of 80. About 9% suffered a serious fall injury, fractures, head injuries over 3 years, and the risk was meaningfully higher among those on moderate to high-intensity blood pressure treatment. For an older adult, a hip fracture can be as life-changing as a heart attack. That's why this sits so high on the list. Picture someone like Eleanor, 75, who sprang out of bed to answer the phone, went gray with dizziness, and fractured her wrist on the dresser. Her medication was working perfectly. She simply stood up too fast for a body whose reflexes had naturally slowed with age. Your free protective routine. Follow the sit, pause, stand rule. When you get out of bed, sit on the edge for a slow count of 30 before rising. Stand up holding something solid. Keep a small light on for night trips to the bathroom. And sip water through the day. Dehydration makes this dramatically worse, which connects directly to number 3. This pairs beautifully with number 2's home monitoring because you can actually measure how far your pressure drops when you stand. Now, speaking of things your body shows you on the outside, let's talk about your ankles because they may be sending a message. That's number 6. Number 6. If you take Amlodipine and your ankles or feet start to swell, your body is sending you a message you should understand, not panic over. Here's why it happens. Amlodipine relaxes your arteries more than it relaxes your veins. That mismatch raises the pressure in the tiny vessels at your ankles, and a little fluid seeps out into the surrounding tissue. The result is puffy ankles, often worse in the evening and better by morning. This is genuinely common, and it climbs with the dose. Clinical trial data show peripheral swelling in roughly 8% of people on the 5 milligram dose, rising to over 20% at 10 milligrams. It's also more common in women and in older adults. Here's the reassuring part: most people are never told. This kind of swelling is usually not a sign of heart or kidney failure. It's a plumbing effect from the medicine. But, and this matters, new swelling in only one leg, especially with pain, warmth, or redness, is a different animal and needs prompt medical attention. Picture someone like Frank, 70, who saw his ankles balloon after his dose was bumped to 10 milligrams and was convinced his heart was failing. In reality, it was a textbook, manageable amlodipine effect, and his doctor had simple options. At home, for free. Elevate your legs above heart level for 15 minutes a couple of times a day. Keep walking to pump fluid out of your legs, and tell your doctor rather than tolerating it silently. Here's a beautiful synergy tip that ties straight back to numbers 9 and 5. A meta-analysis in the American Journal of Medicine in 2011 found that adding an ACE inhibitor, or an ARB, yes, drugs like Lisinopril or Losartan, reduce this calcium channel blocker swelling by about 38%. The very 3 drugs in this video can work as a team. Now, speaking of Lisinopril, there's a side effect that drives people quietly crazy for months, and most never connect it to their pill. That's number 5. Number 5, that nagging, tickly, dry cough that won't quit. If you're on Lisinopril, your blood pressure pill may be the culprit, and almost no one makes the connection. Here's the science in plain terms. ACE inhibitors like Lisinopril don't only block that vessel-tightening hormone, they also let a substance called bradykinin build up in your airways. Bradykinin irritates the cough receptors in your throat and lungs, triggering a persistent, dry, tickly cough. It isn't dangerous to your lungs, but it can be maddening, and it can rob you of sleep. How common is it? A review in the journal Chest in 2006 put the incidence of ACE inhibitor cough anywhere from 5 to 35% of users, and it's more frequent in women and in older adults. Here's the empowering part. A network meta-analysis pooling 135 trials and more than 45,000 patients found that ACE inhibitors cause this cough roughly 3 times more often than ARBs. That's the key. Losartan, an ARB, hardly causes cough at all, at a rate close to a sugar pill. So for many people, the fix is simply a conversation about switching classes. Picture someone like Susan, 66, who spent 8 months bouncing between cough syrups and allergy pills, convinced she had a chronic chest problem. She'd started Lisinopril 9 months earlier. Once her doctor switched her to Losartan, the cough vanished within 2 weeks. Your free action step: if you developed a dry cough after starting Lisinopril, even months later, do not just stop the pill and do not suffer in silence. Write down when the cough started and when you began the medication, and bring that timeline to your doctor. Never assume it's just getting older. This connects right back to number 9. Knowing your drug class is what lets you spot this in the first place. Now we move into the truly critical territory, because the next 3 items can affect your kidneys and your heart rhythm. Number 4 is about a mineral hiding in your kitchen. Number 4, and now the stakes rise sharply. If you take Losartan or Lisinopril, you must be careful with potassium, because these 2 drugs can quietly raise your potassium level, and too much potassium can be just as dangerous as too little. Here's the mechanism. Both ACE inhibitors and ARBs tell your kidneys to hold on to potassium rather than flush it out. On their own, in a healthy person, that's usually fine. But pile on potassium from outside, supplements, or those salt substitutes and light salts on the grocery shelf, and the level can climb too high, which can disturb your heart's rhythm. Now, this is where I have to be precise with you, because the headlines can mislead. The Salt Substitute and Stroke Study, published in the New England Journal of Medicine in 2021 with nearly 21,000 people, found that swapping regular salt for a potassium-enriched salt substitute cut strokes by about 14% and deaths by about 12%. Wonderful news for the general public. But read the fine print. That study deliberately excluded people with serious kidney disease, and most participants were not loaded up on potassium-raising drugs. Those potassium salt substitutes are exactly what someone on Losartan or Lisinopril may need to avoid. The same product that helps the crowd can harm you specifically. Picture someone like David, 73, on Lisinopril, who switched to a potassium health salt, believing he was doing his heart a favor, and added a daily potassium supplement on top. His routine blood work caught a dangerously high level before it caused harm, a quiet near miss. Free steps today. Turn over any low sodium or light salt and look for potassium chloride on the label. Don't start potassium supplements without your doctor's blessing. And make sure your potassium is checked with a blood test, which is exactly the partnership theme of number 1. This matters more after 65, when kidney function naturally declines and clears potassium less efficiently. Speaking of the kidneys, there's a common painkiller in nearly every medicine cabinet that can combine with your pills to harm them. That's number 3, and it catches people every single day. Number 3, the over-the-counter painkiller you reach for without a second thought may be working directly against your blood pressure pills, and in one specific combination, it can injure your kidneys. I'm talking about NSAIDs, ibuprofen, naproxen, and the like. Here's the plain English mechanism. These painkillers cause your body to retain salt and water and narrow certain blood vessels, which pushes your blood pressure up and partly cancels the medicine you're taking to bring it down. But there's a more serious danger doctors call the triple whammy. When you combine an NSAID with an ACE inhibitor or ARB, like Lisinopril or Losartan, and a water pill or diuretic, the 3 together can choke off blood flow inside the kidney and trigger sudden kidney injury. A large study by Lapie and colleagues in the British Medical Journal in 2013 found that this triple combination raised the risk of acute kidney injury by about 31%, with the danger highest in the first 30 days. A separate analysis in Kidney International in 2015 found the combination increased the risk by roughly 64%. These are not rare exotic drugs. They're sitting in your cabinet right now. Picture someone like Patricia, 71, on Lisinopril and a water pill, who took ibuprofen around the clock for a flare of knee arthritis. Within 2 weeks, her kidney numbers worsened sharply. Reversible, thankfully, once the ibuprofen stopped, but a genuine scare. Your free protection. For everyday aches, ask your doctor or pharmacist whether acetaminophen is a safer choice for you, since it doesn't carry the same blood pressure and kidney risk. Always tell your pharmacist every prescription you take before buying an over-the-counter painkiller. That 30-second conversation is free and can save your kidneys. And stay well hydrated. This ties straight to number 4, because the same kidneys that handle potassium are the ones at risk here. We're down to the final 2, and number 2 is the simple home habit that quietly outperforms almost everything else. Number 2, and we're almost at the top. Measuring your blood pressure at home correctly may be the most powerful free tool you own. Here's why it beats relying only on the doctor's office. Many people's pressure spikes the moment they sit in that exam room. It's called white coat effect. Others read perfectly fine at the clinic but run high the rest of the day, which is even more dangerous because it hides. A handful of office readings a year simply can't capture the real story. Your numbers at home, in your own chair, tell the truth. The Sprint trial taught medicine a profound lesson here. The target you aim for genuinely changes your odds. Aiming for tighter control produced that roughly 27% reduction in heart attacks, strokes, and cardiovascular death compared with a looser target. But you can only hit a target you can see. And home monitoring is how you see it day to day, between visits. Picture someone like George, 69, whose office readings looked acceptable, so his dose was never adjusted. When he finally tracked his pressure at home for 2 weeks, his evening numbers were running far higher than anyone realized, information that let his doctor fine-tune his treatment and very likely prevented a stroke. Here's how to do it right, at little or no cost. Use a validated upper arm cuff, not a wrist gadget. Before measuring, sit quietly for 5 minutes, both feet flat on the floor, back supported, arm resting at heart level, and don't talk. Take 2 readings a minute apart, morning and evening, and write them in a simple notebook. Bring that log to every appointment. This is the engine that powers number 1, because the single most important habit of all is what you do with these numbers and who you do it with. Let's reveal number 1. And here it is. Number 1, the habit that determines whether these medications add good years to your life or quietly cause harm. It's this: treat your blood pressure care as an active partnership with your doctor, with regular lab tests, honest reporting, and periodic medication reviews, and never adjust these drugs alone. Everything we've discussed flows into this one principle. Here's why it sits at the very top. Losartan and Lisinopril require periodic blood tests to check your kidney function and your potassium, the very risks from numbers 3 and 4. Amlodipine's effects, the dizziness from number 7, the cough from number 5, every one of these is something your doctor can adjust, but only if they know. And there's a delicate balance the research makes crystal clear. On one hand, the sprint analysis of adults aged 75 and older, published in JAMA in 2016, showed that controlling blood pressure cut cardiovascular events and deaths by roughly a third even in our oldest patients, proof that age is never a reason to give up on treatment. On the other hand, that Yale Fall study from number 7 reminds us that more medication is not always better for a frail, older body. The right amount is personal, and only a partnership can find it. Picture someone like Dorothy, 78, who brought her home blood pressure log and her wallet medication card to every visit, asked at each appointment whether every pill was still necessary, and never changed a dose without a phone call. Over the years, her doctor trimmed one unneeded medication, caught a rising potassium early, and kept her steady and on her feet. That is what partnership looks like, and it is available to absolutely everyone watching. So here are your free Do It Today steps. Make sure you have blood work scheduled to monitor your kidneys and potassium. At your next visit, ask the single most powerful question in medicine. Is every one of these pills still helping me? Report side effects instead of enduring them. And never start, stop, or change a dose on your own. Pair this with your home log from number 2 and your medication card from number 9, and you walk into that office as a true partner, not a passenger. Let's bring it home. At number 9, know exactly what each pill does because you can't guard against a side effect you don't understand. At number 8, never stop suddenly and never double up a missed dose. Protection lives in consistency. At number 7, rise slowly to outsmart dizziness and avoid a life-changing fall. At number 6, watch your ankles as a clue from amlodipine, not a cause for panic. At number 5, recognize that stubborn dry cough as a possible lisinopril effect with an easy fix. At number 4, mind your potassium and check those salt substitutes. At number 3, beware the painkiller trap and protect your kidneys. At number 2, measure at home the right way. And at number 1, make your care a true partnership with regular labs and reviews. Here's the message I most want you to carry. It is never too late, and you are never too old to take better control of your health. The Sprint research proved that even adults in their late 70s gained real protection from heart attacks and strokes. Improvement and prevention are genuinely possible at any age, starting today. Now I'd love to hear from you. Which of these 9 will you act on first? And what's the biggest challenge standing in your way? Tell me in the comments. Your story may help someone else watching. If this helped you, please like this video, subscribe for more plain language health guidance, and share it with someone you love who takes a blood pressure pill. It might be the most important thing you send them all year, because the best time to understand your medicine was the day you started it, and the second best time is right now.